And I just want to echo all the panelists' thanks to the folks who put today together, and including in particular the folks from People Care Foundation in terms of having another corporate partner and philanthropist in the mix. It's really wonderful to see. I would like, I have, as Lisa alluded, sort of two roles in a small state. It's very common to wear multiple hats. So I do want to talk to you really sort of individually with those hats, starting with my role as chair of the Governor's Commission, and just give you a little bit of just a quick primer and slice. You've heard a lot about the strategy. I don't want to go too deep, but I do want to share with you the process and the methodology behind why we did the strategy the way that we did it, in the hopes that it benefits you as a tool, because that was really our ultimate goal. The commission was established in the year 2000 by the legislature with really three purposes. One, to create and implement a comprehensive strategy for the state of New Hampshire to address alcohol and other drug issues in the state. Two, to oversee the Alcohol Abuse Prevention and Treatment Fund, which is the state's public funding pool for substance use disorder services that is, by statute anyway, a percentage of proceeds from our state liquor sales as a control state. So a small percentage of those profits go into, ideally, preventing and treating the issues that might be caused by the sale of alcohol and certainly other drugs. And then third, to advise the legislature and the governor on an annual basis around policies and budgetary issues about that focus on substance use disorders, economic costs to the state, evidence-based policies or practices that need to be implemented, and what the financing mechanism really needs to be in order to fund a robust response to substance use disorders. So under the lens of that, and I will also share that just quickly, the commission is made up of the heads of almost all of the state agencies. So the Attorney General, Commissioners of Health and Human Service, Safety, Education, the Adjutant General of the National Guard, 4 community providers, 2 prevention, 2 treatment, as well as 4 legislators, 2 from the House and 2 from the Senate, and perhaps a couple of other folks that I'm missing. But nevertheless, a robust group of state leaders across the system, understanding that the issues of drug and alcohol abuse cross sectors, as we know and as we see here today, in terms of our panelists and all of you. So it was the Attorney General and Commissioner Barthelmess from the Department of Safety that approached the Governor's Commission about 2 years ago to really ratchet up the attention and awareness of the Commission around prescription drug issues. They, along with Commissioner Wren from the Department of Corrections, who's also a member, had been doing a number of activities to try and, via law enforcement and practices within corrections, to stem the tide of prescription drug abuse. But quickly came to realize that this isn't a law enforcement issue, it's a public health issue. It impacts law enforcement, but they can't bear, they're not the source, the sole source of where the solution lies. Then we needed a much more comprehensive response. So with their push and their drive, the Commission engaged with the Center for Excellence that Lisa represents about a year-long process, interviewing community stakeholders across various sectors, the business community, health and medical, education, law enforcement, and some of the community groups such as the regional prevention networks and community coalitions, to get a sense of what was going on the ground, what were solutions that were already being implemented. As Lisa said, this was not an issue where nobody was doing anything. Many of you in this room have been actively engaged in trying to address this issue for quite some time now. So for us, the effort was really to learn what's going on now in communities, what's missing, what's needed, and can we knit it all together in a comprehensive strategy document that really can capture in a coordinated way what's really needed to turn the tide. And so we did that through, again, some community meetings and conversations over the course of about a year. We hosted a major summit last fall. Senator Bradley was there, many other folks in this room. We had the Director of the Office of National Drug Control Policy, Bill Kurlikowski, come to the state and share some of his thoughts with us. Obviously very interested in seeing movement in New Hampshire as Karen alluded, one of the only states without a monitoring program. And the result was the state strategy that was released in January. That Lisa held up. It is not light reading, so if you're really, really bored, I guess you could take a look at the whole thing. But you also will see in the back of the room some posters that really highlight some of the strategies that are here located in this document. The key piece and takeaway around the strategy that I want you to know in terms of, again, our goal is that it was really as a tool. There are lots of state plans that get created, state plan for mental health, even the substance use plan that was created in 2007. They're really lovely documents, but they're not action documents. They don't give enough information, enough detail, and enough kind of manualized action steps that a community could take a strategy created on the state level and implement it locally. We feel we've done that with the prescription drug strategy. We already know, I mean, today is really a symbol of that. Other regions have started to take that strategy and localize it, adopting some of the practices that are recommended. So we're most excited about the fact that this is really a tool for you. But in addition to that, obviously, there needs to continue to be movement on the state level. So in terms of what we're doing with that strategy, I commissioned underneath the Governor's Commission an implementation task force that is charged with looking through this comprehensive strategy, prioritizing state-level activity that needs to take place. Again, the strategy does look at what are some gaps in the array of interventions that are in place that we need to address. And also to look at policy recommendations, both on the local and the national level. You're going to hear Senator Bradley talk about the monitoring program legislation that he is leading the charge for. The Commission is in deep, deep support, standing shoulder to shoulder with him, and will be doing so as that begins to navigate the House next week, and I'm sure he'll tell you more about that. But I am particularly interested in the state-level task force looking at what other policies need to be put in place. Do we need to change rules that would allow for easier community collection of unused prescription drugs? Disposal rules, things of that nature. Where are there federal policies that may inhibit the state's ability to be ultimately responsive? So we are looking at those right now. The task force has until August to come back to the governors, the full commission, with a priority list of state-level activities to advance this work. But again, it's being done under the lens of trying to support all of you on the ground and in the community, so that we really hope that you see this document, the recommendations that are located on the wall there, as actionable to you. And when this region begins to deepen their work in this area and you find barriers that really require state response, the Governor's Commission is the place to take that information. We work very closely with Melissa and the other regional network coordinators. We plan to increase doing that so that we can be hearing directly from communities to make sure that this is on track. I don't do strategy for the sake of strategy. I, as chair, expect results and want to report those results to the legislature and the governor, as we are supposed to by statute. So we will be looking to see the tide turn in the medical examiner's office and in our emergency rooms and doctors' offices over the coming years. So hopefully you find this as a tool for you. I will also suggest what is most exciting for me and for the Commission is that the Commission is not the only group that is owning this strategy. On the statewide task force, which is being chaired by Dr. Seddon Savage, who's a national expert in opioid addiction and evidence-based pain management techniques. We also have the Pharmacy Board. Pharmacy Board's here today, I know, the Medical Society, the Nurses Association, the Hospital Association, Senator Bradley, several other members of the legislature, the Attorney General's office, Department of Safety, and others. So it's a very high-level group of multiple stakeholders, and business and industry, if I didn't mention them, is a really exciting new partner for us. Because we understand that this requires a comprehensive response. The Commission could own this strategy, but I can guarantee it, we can't do this without your help, and without the help of some of those state partners. So it's really exciting for us to see this document and the conversation that's happened move forward. If I can take that hat off for a second and just talk about my role with the Charitable Foundation, as Lisa alluded, we are the largest philanthropic body in the state of New Hampshire. We're one of the largest community foundations in the country. We grant out about $32 million a year in grants, and as a community foundation, we fund in all sorts of ways. But our second largest fund is from a single donor. It's 10% of our assets, about $40 million, to alleviate the burden caused to the citizens of New Hampshire by alcohol, tobacco, and other drugs. We've had that fund in place for about 12 years now. Our donor created an organization called New Futures. Many of you would be aware of that organization. Amy Pepin is here from their office. They're a non-profit, nonpartisan advocacy organization around substance use. Advocacy was a priority of our donor. But we have also used those dollars to affect change in the community by supporting evidence-based treatment practices in particular over the last few years for both adolescents and adult offenders returning to the community from incarceration. We are in the process, as Lisa alluded, we've made grants and are co-funding the 10 regional prevention networks at the moment in partnership with the Bureau of Drug and Alcohol Services, and Ann Crawford is here from that office. That is the beginning of a 10-year investment on the part of the foundation in substance use prevention. We expect to be putting out the majority of our substance use related assets to that purpose, beginning later this year and for the next 10 years. We can't do it alone. It should be no surprise to you, and it was alluded to earlier, that public resources for prevention services are dwindling. A lot of direct service programs that can work and provide educational services for young people and families and communities have vanished if they're not about to do so. So we are not going to be a panacea and solve all the problems. But as a private funder with flexible resources towards this purpose, really look forward to supporting innovative practices in communities that get at these kinds of solutions that we're talking about today. The last piece I will say is a challenge to you, which is that I'm going to go out on a limb and suggest that although I hope what you've heard so far provides a deeper sense of context around this issue, you wouldn't be here today if you didn't already think this was a problem. So let's start with that. But I want to kind of take it a step further, because I certainly hope, and I know that part of today is not just for you to have an awareness of this issue, but to engage in action, partnering with some of the conveners of today's meeting to move this strategy forward. I can't again emphasize how important your deep engagement in this work is, not just coming to a meeting and eating a yummy breakfast, but participating actively, creating those networks of communication and strategy and coordination so that we can create a comprehensive response here. But if you only do that around prescription drugs, you fail. I want to go back to something that Dr. Andrews said, which is that his office was looking at this issue in 2004. It's now 2012. And due to inaction, we are where we are today. We're not in a prevention arena here. We're in an intervention arena. It's too late to prevent prescription drug abuse from hitting the state of New Hampshire. We missed the boat on that. We've got a comprehensive response, and it's exciting, and I with my dying breath, we're going to move that needle in the next few years with your help. But I'll tell you what, that right behind prescription drugs is the next thing. And it's whatever it is. You know, there's growing concern around synthetic marijuana and synthetic drugs that are available for sale that are very, very difficult from a policy level to regulate. I've talked to many folks who've actually heard about it but said, oh, well, that's not an issue right now, but prescription drugs, prescription drugs. So I just want to caution you that I hope your commitment to action today goes beyond just tackling prescription drug abuse, because if it doesn't, we will all be gathering together for eggs about 3 years from now, talking about the next big thing that is taking the lives of our citizens. So this is one drug with one set of solutions, but it is not the only problem. And I hope that the action you commit to today translates you into being prepared to take commitment and action on drugs and alcohol as a whole issue, a whole public health threat, blind of substance in particular, that is threatening the livelihood and the safety of New Hampshire that we all value so highly. So I hope this is a deepening of your work, but not the end. Thank you very much.